washing my hands. How we doing today?
I'm well. How are you?
I am great. I am Nandi. I am the nurse midwife here today. I'll be doing your ear and your eye exam. But first, before we get started, can you tell me your name and your date of birth?
Yes, it's Leo, October 3rd, 1987.
Beautiful. All right. So throughout the process, just feel free to ask any questions. Shout them out as we're going along. There'll be some touching on your face, and I'll be using my otoscope and a pen light here, okay? So just starting off with your eyes, I'm checking out your eyebrows, making sure that they're bilateral, they look nice and thick and healthy, making sure that there's no lesions, there's no scaling. Moving on to your eyelashes, I see that they are evenly distributed. They do curve outwards. Checking out your eyeballs, I see that there's no protrusion, and there's also no sinking of your eyeballs. We're gonna move on to your conjunctiva and your sclera. So for that, I'm just gonna take my hands, I'm gonna pull them on your eyelids, and if you can look up for me, please. Beautiful. See that your eyes are nice and glossy and moist. The sclera is nice and white. That tissue is pink. I can see some of your vessels, your retinal vessels, which is normal, and everything looks great. All right, so I'm gonna check out your light reflex of your eyes. So I'm gonna take my pen light here. I'm just gonna shine them in one light, and I'm looking for consensual light reflex in the opposite eye. So I'm starting here. I see that direct light reflex and then consensual. Then looking at the opposite, I see the direct reflex and then consensual constriction in that opposite eye. Beautiful. I'm just gonna shine my light on the side of your eye, checking out your cornea and your iris. I see that your iris is nice and flat. It's even in color. It's nice and circular. I also see that there's no opacities in your cornea. Everything looks nice and clear and nice and healthy. Beautiful. So I'm gonna take a closer look here, looking at your eye again. I'm just checking for a few things while I'm here. I'm looking at your media to make sure that there is no opacities, checking your red reflex, making sure that it is present and in the same place on both sides. I'm also looking at your optic disc, making sure that it is nice and pink and it is round and distinct. I see that your vessels are even in ratio, about 2 to 3, and they are paired. Those arteries are nice. I'm gonna switch hands here. Nice and red, more red than those veins, which is beautiful. Looking at your background, I see that it's about the same color as your skin tone, which is nice and normal. And then lastly, I see your macula is at about 3 o'clock and 2 DDs from the disc. Nice. All right, well that looks good. Let's move on to accommodation. So for this part, you're gonna go ahead and look into the distance, and then you're gonna look at my finger. Nice, one more time, look into the distance and look at my finger. Beautiful. So I'm checking to make sure that your eyes are able to accommodate by coming in closer and that your pupils also constrict. All right, so we're gonna move on to your external ear. So I wanna start by looking at them, making sure that they're nice and bilateral and even on both sides. There's no crusting, no lesions. I don't see any discharge, no redness, no thickening of your ears, which is great. So I'm gonna check for tenderness now. I'm gonna take one finger and press it onto your tragus firmly, okay? Any pain?
No.
Beautiful. And one more time, any pain?
No.
Nice. Looking at your external auditory meatus this time. Again, I'm looking a little closer on the inside, making sure that there's no swelling, that there's no redness. A little bit of earwax present is normal. We're gonna move on to the otoscope portion. So I'm gonna take my otoscope, I'm gonna turn it upside down here, and then you're gonna tilt your head ever so slightly. Beautiful. While I'm here, making sure that there's no redness, no swelling. I'm also pulling your pinna up and back. No redness, no swelling. There's no foreign bodies here. Everything looks nice and normal. We're gonna move on to the other side. Again, I'm gonna use my left hand this time, pull your pinna up and back. Everything looks normal, no redness, no swelling, no foreign bodies. And while I was there, I could see your tympanic membrane, which is nice and gray and shiny in color. It is translucent as it should be. I can also see the light reflex on both sides, which is good, which is normal. I can also see your umbo, your manubrium, your annulus, and the short process. So we're gonna move on to the eardrums as well. I'm gonna look one more time. Beautiful. I see that it is pulled to the center and there's no perforations, which is great to see. All right, so we're gonna finish up with a whisper test. So for this, you're gonna take a finger and press it into your tragus of the opposite ear. So I'm gonna start on this side. Go ahead and push into the tragus of that ear. I'm gonna whisper 3 things, and once I'm done, just go ahead and say them back to me, okay?
Okay. 5F2.
Perfect. Opposite. And beautiful.
KLM.
Beautiful. Well, you passed that. I'm glad you can hear. That's a good thing. That pretty much sums up our exam. Do you have any questions or concerns?
No, not at the moment.
No? All right. Well, I appreciate your time. Thank you so much.
Thank you.